but I'm also going to mention a different kind of bone. We say that there are 206 named bones in the human body. Doesn't mean that everybody has 206 bones. They might have more, depending, because there's certain bones that some people have and some people do not have. And this is one of those bones. It's in the cranium, and they're called Wormian bones. And so the sutures of the cranium, those immovable joints where two skull bones articulate, there are sometimes these little Wormian bones that will form in those sutures. Not everybody has them, and if they do, they don't always have the same number. Now, when it comes to the facial bones, there are 14 bones, and most of them are paired up, except for the mandible and something called the vomer bone. The paired bones are the maxilla, zygomatic bones, nasal, lacrimal, palatine, and inferior concha bones. So the mandible is the lower jawbone, so it houses your teeth. It is the only movable joint in the face, so that we can open our mouth, eat, talk, etc. And it is the largest and strongest bone in the face. You might want to highlight that. So this is what your mandible looks like, and it has all kinds of things going on. We're going to learn some of the markings and processes of the mandible. Then we have something called maxillary bones. And so maxillary bones are your upper jawbone. They have, again, they house teeth, but there are two. And so what they do as you're developing, they will fuse together in the middle where you have kind of a dip in your lip called a frenulum. And they are what we consider the facial keystone bone. And it says they articulate with all other facial bones except the mandible. You would think that your upper jaw would articulate with your lower jaw, but it actually, your mandible articulates kind of behind the maxilla. So this is what the maxilla looks like. And you can see the maxilla, it looks like they're articulating here with the mandible, but they are not, or it is not. Then you have your cheekbones. Cheekbones, the scientific name for cheekbones are zygomatic bones. You've got two of them. And they are going to form your cheeks. And then it says inferior lateral, meaning the inferior and lateral portion of your orbits that house your eyes. Other facial bones are your nasal bones. You have two nasal bones. So if you break your nose, you break your nasal bone. So remember that we have hyaline cartilage that's on the tip of our nose, and that articulates with the nasal bones. And you have two of them that are going to fuse at the bridge of your nose. And then the smallest bones in the face are called lacrimal bones. And they form the medial walls of the orbit. Again, that's where you house your eyes. And that's where we have our tear ducts. Then we have something called palatine bones. And palatine bones form the palate of the roof of your mouth. And so if you have a cleft palate, the palatine and the maxilla bones have not fused together, and so there's a gap on the roof of the mouth that can be easily fixed by surgery. Then you have something called a vomer bone, and it's a plow-shaped bone that forms part of the nasal septum. And the nasal septum is the barrier in the nasal passageway that separates your two nostrils. And so a bone on the bottom and top actually make that nasal septum. And so if you have a deviated septum, one of those bones has been broken and reformed kind of at an angle. Then you also have something called inferior nasal concha. And there are these curved bones that are found in the nasal cavity. So the rest are going to be mainly pictures. So this is the face and the cranium together. You can see where all the different bones lie. And so now it's pointing at the facial bones. So you've got your zygomatic bone, you've got your nasal bone. This is the vomer. So you can see that the vomer forms some of the, or half of the nasal septum. And right here, the ethmoid bone actually forms the rest of the septum to make sure that your nasal passageways have two different nostrils and two air passageways. Then this is the nasal concha. This is the inferior nasal concha. The middle nasal concha is part of the ethmoid bone, but the inferior nasal concha are their own bones. And then you can see the rest of the bones in the face. And then we've seen the posterior aspects. So this is what, when we're talking about those wormian bones, this is where those wormian bones would be found. They're found in the sutures. So this individual would have two. They call them sutural bones or wormian bones. And they would have two extra bones in their skull. And then this is just the lateral aspect, showing you where all the different bones of the skull and the face are. And then this is the interior. So they've cut the skull in two so you can actually see how the bones do go all the way through, because we have basically a separation between our cranium and our face. So there's a place that separates like the nasal passageway from the brain itself. So there's bone that is going to separate that. This is the inferior portion. So you can see we've got the, this is where I was talking about if you have a cleft palate. Here's the maxilla bones that are making the roof of the mouth, and then the palatine bones that fuse in the back. And so when you have a cleft palate, none of this fuses, and so you have basically a hole. And what this is supposed to be doing is separating your nasal passageway from your oral passageway. And so then you have basically a gap in there. Now this big huge hole, it's called the foramen magnum. It's the largest foramen or hole in the skull, and that is the passageway for the spinal cord to leave the skull itself.